Good afternoon, everyone present here today and listening to this recording. First of all, I would like to thank you all for attending this presentation. My name is Tanu Bam, and I'm a second year medical student at International Medical University in Malaysia. I'm here to present and discuss regarding the determinants of tuberculosis. So the objective of my presentation is to describe the need to address the TB determinants as well as to discuss an essential component of TB preventive measures. The data and information that I'll be sharing and presenting are from the WHO's Global Tuberculosis Report 2021. So the overview of my presentation is I will begin with a brief background of TB and then its determinants, and then move on to a discussion of preventive strategies, and then finally concluding with a conclusion and some closing remarks. Okay, so in the year 2020, it was estimated about 10 million people fell ill with tuberculosis worldwide. And among them, 1.5 million people have died. After COVID-19, tuberculosis is the 13th leading cause of death and the second leading infectious killer. In the image on the right, we can see that TB has infected all parts of the world. And if we look closely, we can see that the majority of the cases are from Southeast Asia, followed by Africa, and finally the Western Pacific. In this diagram, we see that there are 30 high TB burden countries accounted for 86% of new TB cases in 2020. India leads the pack with 2/3 of the total, followed by China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, and then South Africa. Tuberculosis primarily affects adults in their prime working days or productive years. However, all age groups are at risk. Over 95% of cases and deaths occur in developing nations that are strongly fueled by lack of social and economic advancement. HIV-infected people are 18 times more likely to develop active TB. It is also more likely in people who have other conditions that weaken the immune system. People who are malnourished are 3 times more vulnerable. Undernutrition was responsible for 1.9 million new cases worldwide in 2020. Alcoholism and tobacco smoking both increase the risk of TB by a factor of 3.3 and 1.6 respectively. Hence, we need to develop and promote ethical and evidence-based strategy and policy options and take a concrete action to prevent TB among the high-risk population. Over here, we see all the determinants, the main determinants of TB: undernourished, smoking, alcohol, HIV, and diabetes. Prevention. It is the key not only to ending TB, but in reducing the underlying risks and improving the global health. A better understanding of social determinants, risk factors, and the distribution of tuberculosis in society can help in identifying groups that require special attention in order to improve screening of TB, improve early detection of TB, improve early access to public health services, improve adherence to a treatment, and lastly, to improve outcomes of the treatment. Better social determinants of TB awareness and concrete TB preventive measures are equally as important as better healthcare technologies and medications. So by addressing these determinants of the TB endemic requires a multi-sectorial approach, political leadership, and accountability, which was also highlighted in the WHO report. They stated, number one, policy and program development. An advanced and strengthened multi-sectorial approach is needed within the TB control program to fight against the risk factors. Number two, policy implementation. At community level, global and national level policies and programs should be implemented along with the ongoing TB program among the MOH and TB control organization. We should also try to include other sectors such as local government, civil society, youth organization, medical students, and private sectors, so that our reach is to every individual with or without TB. This is very critical and a necessity for a broad spectrum public awareness. And lastly, number three is policy monitoring. Once we have achieved this development and this implementation, our next and most vital step should be monitoring. It is necessary to identify the most appropriate methodologies to be used in member countries to strengthen the TB surveillance. In order to achieve and monitor the above goals and plans, coordination within the government bodies and development partners must be adhered to keep track and evaluate the reduction of morbidity and mortality, new infections, recurrence of old infections, and prevalent cases to assess whether the strategies have effectively worked or not. So this brings me to the end of my presentation. To summarize my main points, the TB endemic is strongly influenced by social and economic development and health-related risk factors such as undernourished, diabetes, HIV infection, alcohol use disorder, and smoking. Efforts to increase political commitment to the fight against tuberculosis should be stepped up, and tailored approaches are required to facilitate effective active TB prevention and control, particularly in the high TB burden countries. The emphasis is on one single shared goal among all of us here: to work together to develop an effective intervention to combat tuberculosis and strengthening our healthcare system. Thank you.